Hello, my name is Linda McAnany, and welcome to my show. We are very fortunate in our community to have two major hospitals and a number of large clinics that will provide wonderful health care to our expanded community. You know, to lead these organizations is not easy because the medical business is very complex these years, or these days, or these months, because of changes in federal requirements, etc. It's an interesting but very complex business. We're very fortunate to have one of our healthcare professionals with us today. He is Jeff Davis. Jeff is the Chief Executive Officer of the Community Health Center in Central Missouri. And Jeff, welcome, and thanks for joining me.
Well, thank you, Linda, for having me.
It's a pleasure. You're relatively new to our community, so
I am.
I think the best thing for us to do is to learn a little bit about you. Tell our audience about yourself.
Well, I moved here in January. I started mid to late January at the Community Health Center, and so that's kind of when we moved up here. I had a job opportunity to go work up there, and so that's kind of when we moved up here. My family has moved up here with me now. It took them a little bit longer to get up here because I had to kind of start earlier than that. But my wife and two kids are up here as well. I moved up here from Springfield. I worked at a community health center down there called Jordan Valley Community Health Center. So I'm pretty familiar with the community health center model and kind of the way it runs. But you know, we were excited to get up here, and you know, everything has been great since we moved up here.
Well, as a board member of this organization, I would tell you we are delighted to have Jeff with us. He comes with wonderful tickets, and he has done an outstanding job the last 4 months. Have you been on board?
Shoot,
About 4
I guess
months?
It has been almost 4 months now, yeah.
But we're delighted to have you. Jeff, the growth of the center has been amazing, and we don't have to go all the way back, although the Community Health Center did start out as a free clinic, I think, many years ago. But give us a little bit of a background of our Community Health Center.
So, you know, there has been just an overwhelming need, unfortunately, for the services that we do provide. And I've seen this with health centers across the nation as well. So, you know, in 2005, I think is when we opened our first clinic down in Lynn. That was where we got our start. Shortly to follow after that, we did open a clinic in Jefferson City in 2006. And then from that point, we had kind of grown those two clinics. We did grow over past the clinic capacity in our current Jefferson City clinic, and we're able to move into where we are now in about 2009. And then we really started focusing also on our satellite locations, making sure that we get out into those satellite communities and make sure that those drives aren't quite as bad coming into town. So we did open a clinic in California, Missouri first in 2012, and then in 2013 we did open another clinic in Fulton.
So it's been an expansion the last few years. Now, it's known as an FQHC. Tell us about FQHCs and tell us what makes them unique.
You know, there's a lot of different things that make FQHCs unique, and you know, I think they're one of the least understood organizations around. You know, really what they're established to do is take care of the safety net patient population. You know, so those individuals that are underserved, that maybe don't have insurance, we can make sure that we cater to those needs. You know, the Medicaid patient population is also a big base of patients that we draw from. You know, sometimes those patients may have difficulty getting into private practices and those kind of things.
Sure.
So we really make sure that, you know, we cater to those needs. And so there's several different nuances that come into play so to make that we can take care of them. You know, one of the big things that we do offer is medical, dental, and behavioral health all under one roof. You know, that's a big core foundation behind what goes into a health center. You have to provide all those core services. So being able for those patients to come to that one-stop shop allows them to remove barriers and be able to come and get care here.
And when you say the underserved, you're really talking about those individuals who may not have insurance or other opportunities for providing the health care costs.
You know, our healthcare system is a very complex
is.
system to navigate. And, and that's really why we're here, is to be able to prevent those patients from slipping through the cracks and provide them a healthcare home where they may not have known of how to access the care.
Sure.
One of the big things that we focus on, is ER diversion. Many of the patients that we see are used to the emergency room being their primary care provider, and so whenever they have a hangnail or sore throat or something, they're going to the emergency room. And so we really want to make sure that we're putting patients into the appropriate care settings and taking care of them.
And that's where the good partnership with the local hospital certainly comes in, is it not?
Certainly.
Now, the main location is on Truman Boulevard.
It is.
But you mentioned we have a couple of other satellite locations. Where are those locations once again, and what services are provided there?
So we have, like I said initially, our first clinic we opened was in Lynn, Missouri. That's where we got our first FQHC founding and made sure that that's where the need was to begin with on the process. Down in Lynn, we do have medical services. I have a physician that's down there 2 days a week. I have a dentist that's down there 2 days a week as well. And then we also have behavioral health that will be down there. They're down there 1 day a week. And so that's one of our smaller clinics. And so we really make sure that, we're keeping our ear to the ground. Whatever the need is down there is what it will staff. So I anticipate that clinic to grow, and that's my hope. Under my leadership, we'll be able to kind of grow some of those clinics. But for right now, we do have those 3 core services. Also, we have a clinic in Fulton. That's one of our newer clinics, but it's certainly one of our most fastest growing as well. We have a dentist there full-time. We also have a hygienist there, and we also will go through, and sometimes we have more than one dentist there just because the need for dental out there is so great. We have a physician that provides services out there as well. Right now it's 1 day a week, but we also have a pediatrician that goes out there and provides services as well. So we're 2 days medical out there. Finally, our last location is in California. That's our second to last newest one. And we do provide all of our services out there as well. We had just recently added behavioral health out there. One of the needs that we had heard was for behavioral health for children's services. And so that was one of the newer services that we added. And that's kind of the model that we're following is, follow the need. And whatever is out there, then we make sure that we provide those services. Sure. We also have a nurse practitioner that travels out there, and she's out there, as well as a dentist who is out there.
And all of these services are also available at the Truman site. Mm-hmm. So you really have an opportunity. I think so many times the community thinks of maybe our center, our community health center, as just being medical, but you do provide dental and behavioral health, and I think that's a good sign. We talk a lot about, first of all, and you've mentioned, you have full-time providers, physicians, dentists, etc., that are made available at these locations. Mm-hmm. Is that unusual?
No, it's not, but I think that's one of the big misconceptions of FQHCs is, that we're a free clinic or it's all volunteer work. These physicians are, we're competing in the marketplace for them with the rest of them. We pay competitive wages, we work with them, and, it's a different kind of medicine, and that's one of the things that I really focus on when we talk to people and recruit people is, it's different, and what I really pride myself on is recruiting physicians that really care about the patient population we serve, because it can be a little bit more difficult at times. It's not, they face different barriers than a private practice would face, and so finding those physicians that are passionate about it and really want to work with you on facing your socioeconomic barriers and understand those and really work with the patients is one of the things that I think is a critical success factor for a health center. Finding those right providers, and there are people out there. I promise.
Oh, absolutely, and they're passionate.
Exactly, and so the work that they can provide and what they'll do with less resources is simply amazing to watch do, and they really, I think, inspire our patients. So it's a niche market. It's not for everyone, but I do think that there are those people out there, and I think we've been very blessed to be able to find several, because we do have several top quality providers that could be having big private practices, but they're passionate about what they do, and I think that's important to know. Is when you come in, the patient comes in, our providers are top notch, and they'll will take care of you.
Now, who can use the services of the community health center?
You know,
Are there limitations?
there really aren't. You know, that's kind of the beauty of the community health center is we're out in the community and anyone in the community can utilize it. You know, and so a lot of times we're the only provider for many miles around, and so we are a convenience factor. So, you know, we do see patients with insurance, and, you know, as well as those that are underserved. You know, anyone can come see us because, you know, we do have that model of convenience. You know, if you can come to one spot and make sure that you get all of your care, it's, you know, it's one afternoon of work you have to take off as opposed to several days or anything like that. So, you know, anyone can come and see us, but, you know, we are going to have, where we're going to differentiate ourselves is we're going to have those additional resources to help people take care of those other additional needs that may not be present in a private practice. So, you know, we work with people on getting them signed up for insurance or Medicaid or whatever we need to do. You know, we're going to have those resources there to take that extra step to hold their hand, for the lack of a better term, to make sure that everything gets taken care of. So, you know, we do serve a wide gambit of patients, and I think that's what makes us special.
Well, and the one-stop shop is, you're absolutely right, that makes it so convenient for so many people, both working and non-working. So we're going to take a break right now, and when we come back, we're going to talk about some of the challenges and funding opportunities for our community health center. Stay with us. We'll be right back.
In America, you are not required to offer food to the hungry or shelter to the homeless. There is no ordinance forcing you to visit the lonely or comfort the infirm. In fact, nowhere in the Constitution does it say you have to provide anything for anybody. Thank you for all you've given. Imagine what more could do.
Welcome back. Thanks for staying with us. My guest today is Jeff Davis. He's the Chief Executive Officer of the Community Health Center here in Jefferson City. And I should say not just here in Jefferson City, but in our central Missouri area. Jeff, we talked about all the services and also those individuals who can take part of those services. Some can pay, some can't. So how are you funded? What are your funding sources?
You know, I think that's it's another area that is a little bit misunderstood. You know, most of our revenue comes from patient service revenue, or the revenue that we bill out to private insurances or Medicaid or anything like those. So, you know, about 80% of the operational revenue or our budget is a part of that patient service revenue. About 20% of that we do is grants. So, you know, that's obviously a portion of our budget, but it's not an overwhelming portion of our budget. So there are federal grants that we get, as well as a few state and local grants that we do apply for. But for the most part, we have a base set of funding that we do get from the feds, and that does allow us to operate and allow us to provide that sliding fee scale. That's primarily what we utilize those grants for, our federal base grant, what we call it, and that's where, you know, when we would slide off any charges, or, you know, because like we talked a little bit earlier about, you know, our patients can get services on a sliding fee scale,
sure,
which would be, you know, based on their family size and income, they can pay what they can afford to pay, and so those federal dollars we get do offset some of those, but by and large, most of our revenue comes from patient service revenue.
Sure, and you are a United Way agency, and I think that's always important to note, because that money that you receive also kind of offsets some of that sliding scale folks as well, does it not?
It certainly does. And, really primarily where we utilize the United Way dollars are, if a patient comes in and they can come up with their code or something along those lines, but we need to get them on medications, but they can't afford their medications. So a lot of times we'll utilize those dollars to pay for some of those medications on the medical side. Also, our dental program is a big user of our United Way funds, making sure that, if someone's in pain or we need to extract a tooth or something along those lines and they just simply don't have the money, United Way has been gracious enough to support us on many years actually to make sure that we have some dollars set aside that we can go through and take care of those patients, get them out of pain and get their dental needs taken care of, as well as getting them on their medications. There's kind of a loophole in the medication situation of, we can get them on prescription assistance, but it takes a little bit for that to kick in, so we can utilize those United Way dollars to get that first prescription in, and so then but we also have another staff member that can kind of go through and jump through the hoops for the patient so that they can get the medications that they need, but they can't afford.
Right. And medications, we all know, are very expensive in today's world, and many times they're not covered except through some additional programs. Partnerships. I know you have a number of partnerships, and they are so important. Talk a little bit about those partnerships.
As a community health center, I truly believe that you're only as strong as your community partners. I can't be everything to everyone, but I'm going to try. And so, really the way that I feel that we can do that is, there's no sense reinventing the wheel. So if there's somebody that does something well, I want to partner with them to do that. We talked a little bit about the hospitals, having those relationships with those hospitals is imperative.
And I think that's important for our audience to know. You have partnerships with both hospitals,
We absolutely do.
Both St. Mary's, or SSN, and Capital Region as well.
Yeah, and that's something that I'm always exploring new partnerships with them. The more that we can do and the more that we can work with them, the better our patients are. So we really strive to work very closely with them. I'm never going to be able to provide the specialists that those hospital systems can provide, but if I can work with them and make sure that our patients get taken care of, that's a big deal to our patients. So we got to make sure that we're working through those partnerships like the United Way. The United Way it helps us to keep the ear to the ground. They can really identify some issues of where we can do and where we can get better. Another big partnership that I work through, the health departments. The health departments do a ton of the same things that we do. And so I really try and make sure that I'm not duplicating what they're doing and they're not duplicating what we're doing. And the more we can work together, we can make our resources go further. And so, those health departments have been imperative to kind of help me to figure out where we need to go, what kind of issues are surrounding us, and then how can we divide and conquer and make sure ultimately the patient's taken care of, because that's what we're here to do.
And they help you keep your ear to the ground, so to speak, of the needs in the community. Speaking of which, behavioral health is a continuing need, is it not?
Absolutely, and we're currently participating in that community health needs assessment that we, and that's another area that we are partnering with. We're partnering with both hospitals, the health departments, and several other people. And that was one of the issues that was identified. We have some behavioral health internally, as we had talked about, but we also work very closely with Compass Health. They are a great provider of behavioral health, and the more that we can work with them, I think really the patients benefit. We do have a couple providers on staff, but then we also partner with Compass to make sure that they take, for example, psychiatry. Psychiatry is something that there's never enough psychiatrists to go around, and so we're partnering with them on a population-based approach. So it's a little bit innovative in the way that we're doing it, but really the way it works is they see our primary care providers, and then they get referred to the psychiatrist. The psychiatrist sees them for a few times, gets them stabilized, and then they collaborate with our providers, working hand in hand to figure out how we handle it. And that way, the psychiatrists don't fill up. If I go through and I just keep referring them out, their practices get full. But if I can work in collaboration and work through those partnerships, it really allows more people to get care and a higher quality of care, and people will avoid slipping through the cracks.
That's exciting, because you're right. It can be a downward spiral unless the cooperation is there between the organizations. What's the biggest threat in your mind to the organization right now?
The need never seems to subside. The need always is growing constantly, and the budgets are getting tighter and tighter. And so I think the challenge is to balance those two factors. How do you take care of as many people as you can, but at the same time balance your budget? And so I think that's probably the biggest challenge, is figuring out, okay, making sure you don't overextend yourself and making sure that you can sustain the operations you're doing, but at the same time, how can you not keep trying to address the need? And so, I think always looking for grant opportunities and being able to make sure that, we're keeping an ear to the ground and making sure that we're meeting the needs, but at the same time balancing that with the limited number of resources that are out there. It can be a challenge, but that's part of the game we play. And I think I have a great staff that is great at working through being efficient and making sure that we get through whatever we need to do. And so I couldn't speak higher of my staff of being able to help us navigate these situations and do more with less all the time.
Well, and Jeff, and I think your point's well taken. He has an outstanding staff. Everyone from the physician staff, the head of physician staff, those administrative people. You have an outstanding group, and they work together as a partnership.
Absolutely.
And that's always exciting. What do you think are the priorities, the strategic priorities over the next couple of years anyway?
From my perspective, truly becoming that integrated healthcare home is my number one priority. When I look at numbers and I look at things, being able to be as much as we can to the patient is my number one priority. I kind of really like to look at it as you put the patient in the center and then you build everything around them. So what else do they need? How do we get them plugged into the services they need? And how do we make sure that they're not missing out on things? I think education is a critical factor in this. A lot of times they don't realize that they can get dental care or that they need to get dental care before their teeth are rotten and those kind of things. And so, I think the more that we can build that healthcare home around the patient, that's really, what our focus is on, and how do we make it easier. The patient population that we see has a lot of barriers. And so from my perspective, my job is to remove those barriers and make sure that they get the care that they need. If it means that I need to do 6 more steps so that they do 2, that's the decision I'm going to make every single time. And and I really try to stress that to our staff. That, there is a method to my madness. When I say this is a new program we're going to do, it's because it's centered around the patient. I really feel that's how we, make sure that we don't lose sight of where we are and where we're going. Is anything you do, you take a step back and realize, okay, is this best for the patient? And if it is, then that's a decision you should make. If it's not, then maybe you should rethink the way you're doing. So, instilling that culture and making sure that everyone's on board with that is, one of our big strategic priorities. The other thing that I look at is, how do we affect generational outcomes? And so, how do we change the poverty situation, or how do we change the overall health outcomes in the community in the long run? And really the way I see that is, focusing really on our women and children's programs. If I can go through and I can get a mom into the healthcare system early in their pregnancy, and I can provide top-notch prenatal care, that means that they're going to deliver a healthy baby. Then if I can take that healthy baby and I can plug them into my pediatrics department and I can plug them into my dental program, they can get raised and make a healthy child. And that really goes through if they are used to going to the dentist, if they're used to getting their shots, if they're used to going to the doctor, and they're used to seeking care in appropriate settings. That's really how I feel I can affect the health outcomes of the community as a whole. So that's really the 2 areas that I see as the focus of what we need to do moving forward and how we can really have a positive impact on the community.
Well, and I think the latter point, I know as we've spoken and as you've spoken to us about, that is a direction that you're encouraging with your staff, is giving the opportunity for the children to have dental help or preventive dental programs. And how important that is, not only for the family, but that's also important for the health of the organization, is it not?
It is. That's kind of the business model behind how you can make a successful health center, is also the business model of how you can make a successful community. So luckily, those 2 things go hand in hand very well. And so we're really focusing on trying to make sure that we are as effective and as efficient with those patient populations, and really, getting people to understand this is why we're here and this is what we're doing and here's how this is going to affect the community in the long run. is really it's a neat thing to do. You know, you can only be reactive for so long. You know, after the teeth's rotten and you pull it, that's one thing. But if I can go through and I can teach people to brush their teeth, and I can get them into doing their 6-month checkups and realize what they do, then I really feel like we can have an impact on the community.
Yes, absolutely. And I think it's important for people to know that if you're interested in more information about the Community Health Center of Central Missouri, call 573-632-2777, or you can visit www.chccmo.org. Either way, you can get hooked up and learn more about the Community Health Center. You're doing an outstanding job, Jeff. God bless you for your compassion and your direction with your staff and with the organization. We're so fortunate to have you. And I don't say that to embarrass you, just so you know.
Well, I appreciate you having me.
Well, it's been my pleasure. And we look forward to seeing you next time. Good night and God bless.